The TENET fracture support was developed to assist surgeons in positioning patients for tibial nailing procedures. The design request was to be able to create an adjustable radiolucent support for tibial nailing procedures that could be used on a regular OR table. The desire was to be able to avoid the time and work involved in setting up a fracture table for procedures that could be done without the table. This product has been widely received, and its uses have grown to include positioning for retrograde femoral nailings and tibial plateau fractures. The TFS is a product that is primarily used for tibial and retrograde femoral intermedullary nailing procedures. The setup is faster, so it decreases the OR time needed for nailing procedures. It is adjustable to fit the size of the patient's leg and the amount of knee and hip flexion required during a procedure. For tibial nailing procedures, it can provide a 90-degree angle for the insertion of the IM nail. The unique features of the TFS is that it can be easily adjusted during surgery to quickly change the position of the tibia to parallel with the table. This is an ideal position for visualization for the insertion of the distal interlocking screws. The TFS has fully adjustable lateral supports to provide additional stability during the IM nailing process. The whole structure is composed of UHMW polyethylene, which is a plastic that is very durable and radiolucent. The procedure to use the TFS is quite simple. The patient is anaesthetized on a radiolucent OR table or on a table with a radiolucent leg extension. After intubation, the TFS is placed on the OR table underneath the operative limb. The length of the femoral platform is adjusted to the size of the patient. This is done by rotating the femoral adjustment knob, sliding the femoral platform over the femoral undercarriage, and then rotating the knob again to lock it in place. There are a series of half circles on the undercarriage that the femoral adjustment cam locks into. The length should be set so that there is no pressure on the sensitive structures on the underside of the knee from contact with the apex of the TFS. After the femoral length is set, the TFS is placed firmly against the patient's buttocks. The TFS straps are wrapped around the table and attached to both sides of the TFS, securing it in place. The TFS is adjusted so that the knee angle is at least 90 degrees. This is done by lifting up on the femoral platform and placing the support leg into the first or second groove on the base. The TFS is then shaped like a big triangle. The lateral supports are put in place but not tightened. The leg is prepped from the toes to the mid-thigh. The lateral supports are then tightened. The leg is then draped with the TFS out of the sterile field. The tibial nail is then inserted according to the manufacturer's instructions. Traction on the limb due to gravity is usually sufficient, but sometimes manual traction of the foot is required. Visualization is performed using a C-arm, which goes around the limb and bed for both the AP and lateral shots. The only non-radiolucent views occur if the C-arm is aligned along the axis of the tibial platform. Along the axis there is 12 inches of material that the C-arm is shooting through. Adjusting the view slightly will remedy this problem. After the nail is inserted, the tibial platform and tibia are lifted through the drape so that the tibia and platform are parallel to the OR table. Ensure that the leg is parallel and firmly seated in the grooves on the base. This position allows the C-arm to be positioned and provide the right angle when trying to get the perfect circles when lining up the distal screw holes. The TFS is positioned under the knee with an angle of about 70 degrees. The actual angle is determined by the surgeon. The lateral supports are not in use in this case. The leg is prepped from the toes to the hip. The leg is draped so that the TFS is out of the sterile field. The retrograde femoral nails are inserted according to the manufacturer's instructions. The position of the TFS is usually not adjusted during surgery. The TENET fracture support works like an adjustable radiolucent bolster for other procedures when a firm radiolucent support is needed under the knee. It has been used for both tibial plateau fractures and ACL reconstructions.